Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, Q banks, one on one sessions, flashcards, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know my disclaimer reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 60-year-old female with a history of diabetes presents with a blood pressure of 148 over 88. According to the ACC and AHA guidelines, when should pharmacologic treatment for hypertension be initiated for this patient? Is it A, only if the blood pressure is consistently over 160 over 100? B, if the blood pressure is over 130 over 90. C, if the patient has no comorbidities and the blood pressure is over 150 over 90. Or D, only if the patient has symptoms of hypertension. Take a moment and tell me what you got, you guys. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here, the stem of the question states, according to the ACC and AHA guidelines, when should pharmacologic treatment for hypertension be initiated for this patient? So we already know that the person's diagnosis is hypertension. They're asking when to initiate treatment. So you do want to look at those assessment details, look and see if they have comorbidities so you can effectively answer this question. So this is a 60-year-old female. She has a history of diabetes. So she does have comorbidities. So that's one of the keys, right? Because if they have comorbidities, we don't want their blood pressure to exceed that 130 over 90 range. And if it does, we go ahead and initiate pharmacologic management, right? Because remember, if they have comorbidities, we don't want to wait and allow their blood pressure to get any higher because they already have risk factors, right? So B is your best answer. All right, question number two. A 50-year-old male with a blood pressure of 140 over 88 and no comorbidities is being seen for follow up. Based on the ACC and AHA guidelines, which of the following is the most appropriate initial treatment strategy? Is it A, start a beta blocker, B, start a calcium channel blocker, B, begin lifestyle modifications only, or D, start a thiazide diuretic? All right, so here, stem of the question states, based on the AACC and AHA guidelines, which of the following is the most appropriate initial treatment for this strategy? All right, so what's going on? This person has hypertension. They do not have comorbidities. That systolic reading is at 140. We don't want them above 140 or 90. It's right there, so you can go ahead and start your medication therapy. And I always tell y'all to start and line up for your blood pressure management are thiazides, ACEs, ARBs, and calcium channel blockers, with thiazides being the captain. There's no reason listed on here that we should rule out thiazide management. So D, start a thiazide diuretic, okay? All right, and question number three. A 68-year-old female with a history of chronic kidney disease presents with a blood pressure reading of 160 over 96. She is not currently on any antihypertensive medications. According to the ACC and AHA guidelines, what is the most appropriate first-line treatment for her hypertension? Is it A, thiazide diuretic, B, an ACE inhibitor, C, calcium channel blocker, or D, a beta blocker? Take a moment to much yet. All right, and the stem of the question here states, according to the ACC and AHA guidelines, what is the most appropriate first-line treatment for her hypertension? So, all right, so again, we know we're treating hypertension, but we're looking for first-line treatment, but we still need to run it back and see what this patient has going on, look at their comorbidities, and see how we need to maneuver. Also, if they have provided with an ethnicity, you want to consider that too, because that plays a part in treatment options for blood pressure management. So this is a 68-year-old female, has a history of CKD. Blood pressure is 160 over 96, so definitely needs medication therapy, right? But the key here is that chronic kidney disease. They have comorbidities, so you need to start the medicine. Their blood pressure is 160. We're definitely starting medication. But even with that starting lineup, we know that we use thiazides, ACEs, ARBs, or calcium channel blockers. But remember, if you need renal protection, your first line is going to be your ACE inhibitor, right? You can use an ACE or ARB if renal protection is required. And so here, the best answer is B, an ACE inhibitor. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. All of the resources that I do offer are linked in the bio of this channel, including my website, so that you can access. But as I always tell y'all, if you're looking to book any of my one-on-one sessions, please either call, text, or email, as I offer a variety of one-on-one session types, and I prefer to speak with you to gauge what you truly need to make sure that you are booking the appropriate session. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.